Hello, and welcome to this video on how to write a case report. Let's start by describing what a case report is. According to Guidelines to Writing a Clinical Case Report, a case report is a detailed report of the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient. In other words, you are covering every piece of a particular patient case from beginning to end. Case reports focus on unique cases. It could be a unique presentation of an illness, a unique treatment plan, or a unique outcome. Whatever makes it stand out, the point is always to add to the knowledge base of other healthcare providers by pointing out something that either goes against the current knowledge or adds to the current knowledge. A case report will also include a brief review of the literature that already exists on the particular topic. Now, you may come across the term case study in your research. A case study is slightly different from a case report. While case reports focus more on describing a particular patient case, case studies usually go a lot deeper into the existing literature, often analyzing research that's been done on a particular topic and giving context to certain findings. For many people, a case report is a great place to start when you are first looking to get published. There are 4 to 5 sections that are expected from case reports. We're going to break each of these down so you know exactly what goes into each section. Also, if at any point you feel lost, the best way to learn how to write a case report is to look at a bunch of case reports. You'll quickly pick up on the general formula the more of them you see. The first section is the abstract. This is a summary of your report and why it matters. I have an example of an abstract here, which we are going to read and break down together. The abstract begins with a description of the particular ailment that is being discussed. Primary malignant B-cell type dural lymphoma is a rare subtype of primary central nervous system lymphoma, PCNSL. We herein report an unusual case of diffuse B-cell lymphoma that presents as a chronic subdural hematoma without extracranial involvement. Now, the second sentence is describing the actual patient case in one sentence. Something you may have noted is that it starts with the word we. Although a lot of formal writing asks you not to use first-person plural pronouns, it is very common practice in a case report to refer to the healthcare team as we. The notable aspects of this case include the patient's immunocompetence, a short clinical history of symptom onset, rapid neurological deterioration, and a final diagnosis of high-grade PCNSL. This third sentence is outlining why this case in particular is unique and, as they said, notable. This case highlights the challenges neurosurgeons face, especially in the emergency setting, when the disease manifests in varied presentations. This final sentence is an excellent way to point out exactly why this case matters and how it can be helpful to the research base. Although it is the beginning of a case report, I often recommend writing this piece last. It's a lot easier to write a summary when you already know exactly what you're summarizing. The next section is the introduction. These usually begin with an overview of the current medical understanding of a diagnosis or treatment plan, backed up by some of the current literature. Since this is a case report and not a case study, the literature piece doesn't need to be exhaustive, but it is important to point out any landmark studies as you provide a background for the reader. Think of it as giving context for the case itself so that you can then discuss later on why this case is unique. Best practice then calls for a sentence at the end of the introduction that introduces the patient and their particular condition. This creates a nice transition from the background into the current case. The third section of a case report is the case itself. If you're familiar with SOAP notes, this is basically a formalized version of those. If you're unfamiliar, SOAP notes detail a case in a particular order. It starts with subjective information. 34-year-old female presented to the ER complaining of chest pain. Then outlines objective information. Patient was sweating and unable to walk. Then the assessment. including blood pressure numbers, heart rate, temperature, etc. And then the plan. What course of action did the physician decide to take regarding labs, referrals, or treatments? The case notes in this section should include a chief complaint and HPI, or history of present illness. It's important to focus only on the facts of the case in this section, which honestly makes it the easiest section to write and therefore one of the best sections to start with. Now we move into the discussion section. This piece is basically a combination of the introduction and the case. You are now bringing together the existing literature with what was seen in this particular patient. You'll outline why this patient case is relevant or important and what makes it worthy of publishing for others to read. This is also where you can break down more specifically how this case expands on current understanding or potentially challenges the current understanding or even is pointing out holes in the current understanding. Last but not least is the conclusion. As with most conclusions, it is a summary of the case report overall. It's also a good place to suggest next steps. You may bring up needing more research in an area that hasn't really been looked at before, a change in a standard approach to a diagnosis, or the consideration of a new treatment plan for an established diagnosis. Ultimately, what is it that you're hoping other healthcare providers or researchers will do with this information? Something to note, pay attention to journal requirements. Some of them ask that the conclusion be a separate section with its own header, while other journals may prefer for it to be included as the final paragraph of the discussion section. I want to end with some important things to consider before you get started with writing your case report. HIPAA and patient privacy are still of utmost importance here. This means not including any of the prohibited identifiable information in your write-up. Many authors will change names to a nickname or just use the first letter of the patient's first name. So if the patient's name was Wendy, you may refer to them as W. You must receive informed written consent to discuss the case either from the patient themselves or from the patient's family if for some reason the patient is unable to provide that consent. If you are including photography, say of a skin abnormality or eye discoloration, make sure the photograph only shows as much of the area as necessary for the reader to be able to understand the discussion. A photograph that includes too many identifiable features may not work. In essence, remember that you will need to provide as much privacy and respect to the patient as possible while detailing their case. If you need assistance writing a case report or would like somebody to review a case report you've written, please feel free to reach out to the CAP office for additional writing support.